The American Medical Informatics Association, or AMIA, annual symposium was in Atlanta last week. It was held at the Marriott Hotel, where apparently an elevator scene from the Hunger Games was filmed. There was a lot of participation from UT Southwestern. We attended the new Learning Health System Working Group meeting. I enjoyed catching up with the women in AMIA, a committee I co-founded 10 years ago that's given women more opportunities to make things happen and to lead. And AMIA is the best place to catch up with friends from the past. For me, that's San Diego, Pittsburgh, Utah, and Melbourne. It's also a great place to catch up with friends from home. We met my predecessor, Chris Lehman, at a cool pizza place for dinner, and you can see what a great showing we had. Several of us from the Clinical Informatics Center spoke at the session. Mujib Bassett gave a talk on how we leveraged Epic's native ETL infrastructure for OMOP implementation. OMOP is a common data model that standardizes the format and content of healthcare data, like diagnoses and drugs, into a standardized vocabulary. Once your health system data is mapped to OMOP, it's easy to reproduce studies and collaborate across institutions. What the UT Southwestern team did was novel. Everyone recognized that OMOP would help them capitalize on global collaboration opportunities for research and benchmarking. However, the way most people have implemented their OMOP projects requires new hardware and new hires to maintain the mapping. UT Southwestern implemented OMOP by attaching it to what's already happening to data coming out of Epic. That way, every time data is exported by the health system, new data is also exported to OMOP without the need for a research team supporting the process. There was a lot of interest from people in the audience in this approach. Currently, we can access EHR data mapped to OMOP from UT Southwestern, as well as THR, Parkland, and Children's. What an amazing resource. Hannah Min from the Clinical Informatics Center Data Science team spoke about the process analysis of hospital bed flow to optimize access. Everybody probably knows that the number of ED visits has been increasing, and patients often have to wait for hours for a bed to open up when the ED physician decides to admit them to the hospital. We have a lot of data that can give us insight into what's taking time and where we can make improvements. First, you need to map the processes for the current possible states. A bed could be vacant and dirty, and if cleaning's ordered, it's then being cleaned. Once it's cleaned, it's vacant again, but clean. When a patient is admitted to that room, the bed is occupied, and when that patient's discharged, the process cycle starts over again. By looking at each bed in each room, they mapped the time the bed was occupied, which is light blue, versus the time the bed was vacant and dirty, being cleaned, etc. From this data analysis, they could see there are two major levers that can influence change in bed cleaning and availability: the number of staff cleaning the beds and the decision about which bed to clean first. So next steps are to look at the high performers to learn from them and to create best practices to speed up patient flow. Rob Turr was part of a panel on human factors in the emergency department. They explained that technological changes affect clinicians in many ways. There are many techniques that can be applied to decrease the burden on clinicians. And one panel member pointed us to an AI clinical decision support implementation toolkit to learn more. The audience asked about how to get better at human factors research when you don't have a human factors researcher on your team. Dr. Turr had an important response.
Right? Workflow mapping, user story mapping, none of these concepts are perfect, and it still doesn't really matter. The idea is to sit people down and have a conversation about the things that you're doing. And frankly, even if all you do is just take the 10 minutes to sit down with them or stand up, I guess, with a whiteboard and start talking about it, it can make a huge difference in catching the really foundational mistakes that often go out in these operational systems because we're in a rush.
My daughter Claire did a food drive on campus, and many of you probably contributed. UT Southwestern was able to provide 500 pounds of food to the North Dallas Food Bank this season. That's 492 meals, thanks to everyone who donated. While we were in Atlanta, Claire took care of our dogs. That meant she was responsible for 6 dogs, her 3 dogs and our 3 dogs. There was some pretty strange but cute behavior during this adventure, including Kari, who just turned 6, trying his darndest to get the rabbit lodging under the decking.